In a groundbreaking move, Health and Human Services Secretary Robert F. Kennedy Jr. took center stage in West Virginia this Friday, urging the state to tackle what he calls a public health crisis. With Governor Patrick Morrisey by his side, Kennedy made a powerful statement that sent ripples across the nation. West Virginia is leading the way, he said, surrounded by local leaders and children at a Catholic school in Martinsburg. But is this the game-changing shift we've all been waiting for? Let's break it down. Kennedy, who is no stranger to speaking out on issues of public health, used this moment to highlight the dire situation the country faces. When my uncle was president, Kennedy recalled, only 3% of Americans had chronic disease. We spent $0 on chronic illness. Sounds almost unbelievable, right? But Kennedy claims that today, the United States spends more on healthcare than the entire defense budget, a staggering contrast to a time when health issues were minimal. The initiative, championed by Morrisey, focuses on several critical measures. One of the most eye-catching steps? West Virginia's effort to remove soda from the eligibility list for SNAP, Supplemental Nutrition Assistance Program. This move could dramatically shift the state's diet, replacing sugary beverages with healthier alternatives. And guess what? It's not stopping there. Morrisey also signed a historic bill banning harmful food dyes in schools, with plans to roll out similar restrictions to the general public by 2028. Imagine the impact of a world with less processed food. Could this set a new national standard? But why is West Virginia leading this charge? The state, unfortunately, has some of the lowest health rankings in the nation. By focusing on healthier foods and promoting exercise, the state aims to set a national example. We're cleaning up our foods, promoting exercise, and putting nutrition back into SNAP, Morrisey proudly declared during the event in Berkeley County. But there's more. Kennedy's broader mission, under his Make America Healthy Again agenda, also aligns with new work requirements for SNAP recipients. This strategy ties health improvements with economic participation. After all, West Virginia's workforce participation rate is among the lowest in the country, and Kennedy believes this is a key part of the equation. Getting people back to work while improving their health goes hand in hand, he remarked. West Virginia is clearly making bold moves, and they've got support on the ground. State Sen. Jason Barrett, who helped spearhead the food dye legislation, applauded Kennedy's leadership on the national level. He's not alone. Kennedy's push for healthier lifestyles, both on the state and federal levels, has gained momentum. But the question remains, will these changes be enough to spark a nationwide revolution? Or is West Virginia's effort just a small piece of the puzzle in a much larger conversation about America's health? The conversation is just beginning. As West Virginia leads the charge, the rest of the country is watching. Could these steps be the key to reversing decades of poor health choices? Or will it take more to turn the tide? Only time will tell, but one thing's for sure, West Virginia is now at the forefront of a health revolution.